Morning. So, just a little background. 2 years ago, I found out that I had a degenerative disease and that all of my teeth needed to be extracted. As a stay-at-home mom, I don't have insurance, I'm not married, and I don't have an income really that can be counted towards anything. I needed to get state Medicaid, so I did. I live in Washington State. It was pretty easy to get enrolled and signed up, but then came the hard part of finding a provider that took the insurance. So I finally found a dental clinic that accepted adults. That's really, really hard to do. And I went in for an exam. I've always taken really good care of my teeth. I've always done the necessary cleanings, checkups, everything I needed to do. I had really great teeth until one day they started breaking off, falling out just by drinking water or brushing my teeth. I noticed that when I flossed, they would chip off and were deteriorating from the inside. So I found a dentist through the provider one, and it's about an hour away from me, which was fine. I went in, they did the exam, told me exactly what I expected to hear, that no amount of money could save them, that I didn't really have an option. So they started the paperwork to get authorizations for complete dentures and full mouth extractions with IV sedation. I have a really hard time getting numb, so along with TMJ, it's really hard to forego a procedure where you have to keep your mouth open for a long period of time. So I opted to let them do the maximum amount of extractions they could do without the authorization, which was 5. While they sent in the paperwork, they told me it would take 14 weeks to get a decision back, and it wasn't guaranteed. So I made the appointment and went in. The oral surgeon was not the dentist that I met with, and mind you, this is the only one that I was authorized to go to. I didn't have an option to pick a dentist. I didn't have any option to find somebody else. There was one that was accepting the insurance, the state Medicaid dental. So I went in for the appointment. He did a couple Novocaine shots and came back 5 minutes later. I wasn't even remotely numb. He put his knee on my chest and his arm on my neck and told me to suffer through it. And I did. I suffered through it, meaning I could feel everything. I could hear everything. He was completely inhumane with no bedside manner. Just trying to get through as many of them as he could. I was just one more person on the list. So I left in complete shock. I was traumatized, just completely amazed that that was the type of oral surgeon quality I would get from having Medicaid. I guess in the back of my mind, I kind of knew that that was a possibility, that I wouldn't have the best quality, but I was hoping I was wrong, and I wasn't. So after about 8 weeks, they called me. I had no follow-up to my procedures for extractions, no nothing. I just kind of went through it, did what I could to take care of my teeth and my mouth after having that procedure. They called me and told me that the authorization had come through for the complete dentures and full mouth extractions. So I was pretty happy, but they did not send the paperwork for the IV sedation, which meant that I would be in a lot of discomfort and pain. I wanted to even just try to pay out of pocket, but the price was so astronomical that, I don't even know how I would have paid for it. So because I don't really have an income, I didn't qualify for credit or a loan or payments or anything. It was straight up out of pocket in the $1,000 range. So that wasn't an option. All I could do was hope that the authorization would come through for the IV sedation. During this whole time, it's been 9 months since that paperwork was resent over and over and over again. The dentist office that I was approved to go to kept fumbling it up. I would walk in the paperwork from the doctor stating that I needed the procedure and what the complications were, and they said they send it off. They didn't. This went on until February when I finally got in contact with the office manager and demanded that they resend it right there while I was on the phone. She did. During this whole time, I've been to the ER. I've been on 30 days at a time of antibiotics that aren't working anymore. High fevers, no energy, just completely ill. I'm sick. It's, at times my whole face on this side is completely swollen. I can't see out of my eye. It's affecting my heart. It's affecting every part of my body. I'm very, very, very sick. So in May, I got the paperwork stating that they approved the IV sedation, which I was ecstatic. Finally, I was going to get rid of the infection happening in my body because it's making it to where I can't work. I can't sleep. I can't eat. I can't do anything. It's just all about my teeth that are mostly broken off at the gums now because they waited so long. The state has this long process of authorizations and not many get approved, but I was lucky enough to get the approval to get the authorization. So I called the dentist back there in Linwood, Washington, Peak Dental, and told them I was ready to make the appointment. The state does not pay for temporary dentures. They only pay for the permanent final product. They want you to wait 4 to 6 months for healing, and that wasn't setting right with me that I wouldn't have anything during that period of time. To get them through the dental office is about $2,400 just for the temporary set. That's a lot of money for me right now. I'm 42 years old. I have 3 grown children, and I don't work because I'm so sick. My job that I had for a very long time, I couldn't afford the COBRA, and so I, basically had to resort to state Medicaid. So when I called the dentist back to make the appointment to get this procedure done, to have full mouth extractions to start the process and get this, infection out of my body, they told me they no longer accept the insurance, they no longer do the procedures, and then I had to find another provider. As you can tell, I was crushed and extremely disappointed, let down. I didn't know what to do. So I called the healthcare authority, and they told me to look up their provider one list and start calling. So I looked at my county, and the only ones that showed up were tribal. They will only work on you if you're tribal. Well, I'm not tribal, so that was out. I called my surrounding counties of everyone on the list. They no longer accept the insurance. They don't take it anymore. So I called surrounding counties to those counties. By the time I was done calling, I was all the way down to the borders. Idaho, Oregon. Nobody takes this insurance. You basically have to be dying before they'll do anything. And even then, they won't do the procedure. The only thing I was told was that it would be a 2 to 3 month wait for a consultation for the ones that did take it, which were very few, less than 5. They are east of the mountains of me, which means at least a 3-hour drive, which I was fine to do. I would definitely make that drive. But all they would do was refer you to the University of Washington or Harborview Medical Center, and their wait lists are as far as November. But that's for the people on their list, and their lists are closed. So right now I have no option. There's nothing. I'm not quite sure what is wrong with this insurance. I understand that the state doesn't pay dollar for dollar. I understand that it's minimum. But something has to change. This is not right. I am getting sicker every day. It's affecting my heart. I'm going to get an infection so bad that it will take my life. I won't have an option. And even then, they'll just treat the infection. They won't take the teeth out. I can't go to work to earn the money to get the procedure because I'm sick. They've put it off 12 months now. It's been 12 months total. And I cannot find one provider in the state that will take this insurance. What good is it? It holds no value. So we have insurance that we can't use. They put so many roadblocks in place that it's impossible. They just hope that people will give up or they'll die trying. I'm seriously going to lose my life to this infection because I don't have any options. It's not right. It's really not right. I don't know where to even start with it. My only option right now is to try to start a GoFundMe page or try to, beg and borrow from people I don't know. I don't have family that can support me and help me through this process. Where do people turn when they need it? What's the point in having this insurance if it doesn't help? If you can't use it? It makes me so sad because here I am, 42 years old. I have an extreme medical need right now. And there's nothing I can do. I don't have anywhere to turn. The monopoly that is on dental care is so sad. It shouldn't cost $5,000 to get your teeth pulled. It shouldn't cost $15,000 to get, dentures. The entire process with minimal surgical procedure is upwards of $10,000 in my area. Where's somebody supposed to go if they need medical care? When the Trauma One centers are turning people down. They're just waiting for people to die. So right now, what I can tell people is to find a dentist that will take it, no matter what state you live in, and hold on to them tightly. Get this taken care of now if you have the option. If you live somewhere that has a dentist that will take this insurance, do not wait. Do not put it off. Don't be lazy about it. Get on the list. Make preventative appointments. Set those appointments now just in case. If you have any inkling that you're going to need some sort of care and you're just putting it off until it gets worse, don't. Because this insurance companies, the state Medicaid, they don't care. They're putting roadblocks in place and making it so hard for people to even get the service that they just give up. I don't know where to turn. I've made over 300 phone calls since last week, and I can't find one oral surgeon that'll take this insurance. I don't know what to do. And I feel like it doesn't matter who I call. It doesn't matter if I spend hours and hours on the phone with the healthcare authority, with my legislation, with anyone, they're just going to wait for me to get so sick that I die from it or I give up. So my recommendation to people is get on it now if you have the option. If you know that you have a medical procedure or some sort of ailment that you need care for, get it done now, because it's only getting worse. People are getting sicker and sicker, and less providers are accepting it. We need to change, and I don't know what it is, but I know that for me, my kids are going to be without a mom if I don't get something taken care of. So while I'm waiting for all these phone calls back from different dental clinics and schools and everything else, I decided that I would try to get temporary dentures for when I did get the procedure done. And at this point, I don't even care if it's IV sedation. I just need the teeth out. Most of them are broken off. That's why I cover my mouth, because it's super embarrassing, and I'm used to doing public speaking. I'm used to being very social, trying to, get the message out that, that I normally have and use my voice. But it's really hard with what I'm going through. So it's really hindered my abilities. So I'm going to do another video based on the store that I found, the referral through someone through Facebook on an Etsy store for Russell Klein. He makes inexpensive dentures for people, and apparently he's a lifesaver. He has changed people's lives tremendously. He does it at very, very low cost, and so I'm excited to see what that's all about. I ordered the impression kit, so I'll do one next. I haven't opened the kit yet. I don't know what it entails. I don't know what's in there. I just know that I paid for it and it got here pretty quickly. So I'll keep updating on what happens with state Medicaid and what their answers are, but right now I've made at least 3 phone calls to them this week, and I was just told to keep looking on the provider list, which is nothing. There's nothing in there. So my only other option is to keep calling dentists and hoping they will take me out of the kindness of their heart and help me get healthy. Because right now I can't even work to come up with the money to get the teeth pulled. I'm not sick. So until next time, thanks for watching, and I will try to keep updating on what happens. Right now the state is not cooperating, and they have no intention of getting more providers on the list. It's just dwindling. So hope nobody else is having to go through what I'm going through, because I'm extremely disappointed in my government and in my state and in the local providers. I understand their position of not getting paid, but there needs to be a change to state insurance. It's pointless. It doesn't help anybody, especially the dental part. And for most of you who know anything about dental, it can affect your whole life. Your oral hygiene, your oral health and well-being can devastate your whole body. And it can really control what happens in your life if you do not have good oral health. So until next time,